Hi everyone, this is the Principles of Electric Stimulation lecture. This is the first in a series of 3 lectures about E-stim. We'll cover this and the next one online, and then we'll do clinical application in class. There are a few slides from this lecture that I am going to point out that we will certainly cover together when we're in lab. So I will make note of that and we will make sure to go over them when we are together. So this one is going to give a lot of background about electricity in general and how we're going to use electrical current in a therapeutic way. So electrical current is a force created by an imbalance in a number of electrons at 2 different points. Electricity is always going to follow the path of least resistance. The negative pole is a buildup of high electron concentration. So if you think back to like high school chem class when you thought about or learned about atoms and how the center had the proton and the neutron and the proton was positively charged and then the electrons circled around the outside and they were all negatively charged and that's how everything ended up balanced. Well, think about electrons and electricity being a negative charge. So if you have a high concentration of electrons, you're going to have a negative pole. The positive pole is termed or called the anode, and that's where we have an area of low electron concentration. So those are just some terms to be familiar with. Here's something that's also maybe not quite intuitive. In order for electricity to flow, we have to close the circuit. We typically think of circuits as sort of like a pathway, and if that pathway is open, then it's interrupted. And wherever it's open, the electrons are going to just flow right out. And so it's not going to be able to complete the circuit and electricity is not going to be able to flow the way that it should. So in order for electricity to flow the way that it should, we have to have a closed or connected circuit. So when you go into a room and you flip on a light switch, what you're doing is you're actually closing the circuit and allowing electricity to flow so that it works the way that it's supposed to. So a couple of the different types of current that we're going to be talking about are direct current and alternating current. Both of these are continuous or uninterrupted types of current. And we have particular types of E-stim that we use that do use either direct or alternating current. Then we can have pulsed currents. These are going to be interrupted currents, pulsed currents. They have on times, off times, and they can be either unidirectional or bidirectional. And then we can also have polyphasic currents, which are kind of like a hybrid of both types or multiple current types together. So direct current, which is abbreviated DC, is a continuous current. It is uninterrupted and it is a one-directional flow of electrons. So the electrons stay on either one side of the baseline, so they are either always positive or always negative. If you think of a typical XY axis, the direct current is either going to flow as a straight line, like it's shown in this picture here. It's going to be a straight line either above the axis or below the axis. If it's above the axis, it's a positive current. If it's below the axis, it's a negative current. This is sometimes referred to as galvanic current, and iontophoresis, which is a specific type of E-stim, but it's one we're going to talk about on its own after we finish this unit on E-stim. It uses or utilizes direct current in order for it to work. So we'll talk more about that separately. Alternating current, or AC, is continuous current again, and the current this time is going to flow positive and negative in a cyclical manner. So this is your sinus wave, which we mentioned and talked about a little bit with ultrasound, but it's going to be positive and then it switches to negative, and then it alternates back to positive and back to negative, hence the name alternating current. So there is no true positive or negative pole, and the electrodes, when you hook them up to the patient, are actually going to take turns being positive and negative. They alternate very, very quickly, like millions of times in a second quickly between positive and negative. So this isn't something that the patient can perceive or that you can feel, but it is an alternating between positive and negative polarities. Interferential current is an alternating type of current. So you've probably seen this or you will see this and feel this when we get into lab. So there are a couple of things that we can measure when we're dealing with alternating current. Peak value is the maximum distance that a wave rises above or below the baseline. So if you go back to the previous slide, the peak value would be the distance from baseline up to the peak, or the distance from the baseline here down to the peak of this curve. We can also have a peak-to-peak value. So again, going back to the previous slide, just for demonstration purposes, peak-to-peak would be the value from here, sort of draw an imaginary line over, down to this peak. So the distance from here to here would be your peak-to-peak value. Cycle duration is from the starting point to the ending point, or one full cycle. So again, one more time, back to the previous slide, this would be the cycle time. This would be one cycle. Starting point at this blue dot, it goes positive, it goes negative, this would be the ending point, and then it would start over again. This is one of the slides that I'm going to talk about when we're all together in class. We'll make some drawings up on the whiteboard, even though I'm not a good artist, that will hopefully help to make these terms make a little bit more sense. There's also a lab that's posted for you that you guys are going to work on, where you'll work on drawing out some of these terms as well on different types of currents and graphs. Hertz are what we use to measure alternating current, and that's the number of time that the current reverses or alternates or changes direction in 1 second. So it's the number of cycles per second. So example would be a current of 100 Hertz would change direction 100 times in 1 second. Current of 1 megahertz, you've heard 1 megahertz before, right? Think back to ultrasound, changes direction 1,000,000 times in a second. So again, this is a very fast alternating between positive and negative. Okay, so those are our continuous currents. We have direct current, we have alternating current. Those are continuous, they're non-interrupted, they will continue to flow the entire time. Now we're switching gears a little bit, we're going to talk about pulsed currents. So these can be unidirectional or monophasic, that means the same thing, or they can be bidirectional or biphasic, and these are going to be periods of electron or electricity flow interrupted by periods of non-electricity flow. And so monophasic or unidirectional means that they're going to stay all on one side of the baseline. Bidirectional or biphasic means they're going to alternate between both sides of the baseline. They'll be positive and they'll be negative in each one of the pulses. Highlight this. Phases are building blocks of pulses. They are individual sections of a pulse. And again, this is one that I'm going to go over with you guys when we get into lab and show you some examples of what this would look like on different types of graphs. So monophasic currents, again, these are pulsed currents that we're talking about. Monophasic means that it's going to stay on one side of the baseline, so it's either going to be all positive or all negative. So think of this comparatively to direct current, except direct current is continuous and monophasic currents are going to be pulsed. So there's going to be on and off times with the monophasic current. But the current is flowing in one direction, meaning it stays all positive or stays all negative. It can take different shapes, and the benefit of this is that it can be applied to a patient with the known polarity under each electrode, meaning we can hook the patient up to treatment and set it up so that it's a positive treatment or it's a negative treatment. And there are different physiologic properties that happen whether you set it up to be positive or negative. High volt is a type of current that we are going to talk about in lab, and it is an example of a monophasic current. Biphasic current, bi means two, so that means it has at least two phases that occur on different sides of the baseline. So they can be symmetrical, meaning that one goes up, one goes down, one goes up, one goes down, and they just sort of alternate back and forth like that. Or they can be asymmetrical too. And again, this is one of those slides I'm going to go over with you guys in lab to show you some examples. Neuromuscular E-stim, some of you may have heard of. It is a type of stim that we use in order to elicit muscle contractions in patients who may be having difficulty achieving that on their own. It's pretty comfortable, but it is a type of symmetrical biphasic current. TENS, which you may have heard of as well, is usually a home version of interferential current. For the most part, it can be prescribed for patients who have chronic pain, and it's an asymmetrical type of current, but it's actually balanced. So it is typically considered a very comfortable type of current as well. I will try to remember to bring in, I have a TENS unit. We used to have one in the lab too, but it walked away somewhere at some point. So I do have one here at home, and I'll try to remember to bring that in so that you guys can see what that looks like. All right, so these, again, we're getting into a couple of slides where I want to do some drawings and diagrams with you in lab to kind of help these make a little bit more sense. But we're going to talk about some terms like pulse duration, phase duration. These are terms that we use to measure pulse currents, right? We can't measure these on a continuous current because continuous currents don't have pulses. So these are only on pulsed currents. So the pulse duration is the distance covered on the horizontal axis, usually representing time. This is going to be a monophasic. A phase duration is the time for each phase to complete its shape. So remember back, I told you to highlight, phases are building blocks of pulses. So phases are going to be like the individual little blocks, and then the whole thing together makes up one pulse. So again, these terms, these pulse durations, phase durations, we can't use them to measure direct or alternating currents because they are continuous. They don't have pulses, so they don't have pulse durations or phase durations. Interpulse interval is the time between the end of one pulse and the beginning of the next pulse. So this is basically the same thing as your off time. Your intrapulse interval is the tiny little space between each one of those phases that are making up the full pulse. So that can't be any bigger than the interpulse interval, or else it would be the interpulse interval. If this is confusing, I totally get it. Like I said, I'm going to draw some pictures up on the board in class, and this will make a lot more sense. The pulse period is your pulse duration plus the interpulse interval. So it's the on time plus the off time until the start of the next pulse, and then it just continues to repeat after that. The pulse charge is the number of electrons that occur within a pulse. It's expressed in microcoulombs, and it can be altered by changing the amplitude or the shape of the wave so that you're fitting more electricity basically into a pulse. A phase charge is seen with biphasic currents, and this is important when we're trying to get a muscle to contract. So we'll talk about some of the types of currents that we use for that. Pulse frequency, now this isn't quite the same as the stimulator frequency. That's going to be generator or machine specific. But for a pulse current, frequency is going to be pulses per second. And for alternating current, frequency is going to be measured in hertz, right? We talked about 100 hertz or a megahertz and what that means. So there's an inverse relationship between pulse frequency and tissue impedance. So what that means in regular words is that the higher the pulse frequency, the less resistance it's going to meet going into the tissue. We will get to this, but skin is going to be our primary resistor to E-stim, and so the higher frequency that we use with our E-stim, the easier it's going to be for that stim to get through the skin. We typically need a pulse frequency over 100 pulses per second in order to depolarize a nerve. So if that's our goal of treatment, if we're trying to depolarize nerves, we typically need to use something with a little bit higher frequency. Pulse rise and decay times. This is the time that is needed for a pulse to reach its peak. So a pulse might go very quickly from 0 up to its peak, or it might sort of ramp up a little bit more slowly. But that's just going to be its rise time. It's measured in nanoseconds. This happens really, really quickly, right? This is typically something that's not perceived by the patient. The quicker that the pulse rises from 0 up to its peak, the more likely it is to cause a nerve depolarization. The decay time is the time that it just takes to get from the peak back down to 0, which is oftentimes very quick as well. We can also have pulse bursts. So these are going to be current that's interrupted by non-current flow, repeating at regular intervals. The rise and the fall is called the amplitude ramp, and ramping causes a gradual increase in muscular force production, which is typically more comfortable for a patient. So ramping is something that you can set on the machines. All of our E-stim machines have the option to change the ramp time. Most of our machines have options of like 0.5 seconds, 1 second, 2 seconds, 5 seconds. And what that ramp time means is it lets you actually set into the machine how long it's going to take to get from 0 to your max intensity. When you ramp, that's going to help to more closely resemble a voluntary muscle contraction. When you voluntarily contract a muscle, you're not firing all fibers at once as much as you possibly can. Your body doesn't allow that to happen so that your muscles don't fatigue as quickly. So with ramping, we're actually slowing that down a little bit and making the contraction look more or resemble more of a voluntary muscle contraction. So just to kind of summarize a little bit and go over the different types of current that we've talked about. So we talked about direct current, and that's going to be paired. That's the type that iontophoresis uses, which again is something that we're going to talk about in a completely separate unit a little bit later on. Alternating current, that's interferential current, IFC or IFS on some machines, or pre-mod. And then pulsed currents, a monophasic pulsed current is high volt, which we are going to use in lab. Biphasic is neuromuscular E-stim, and asymmetrical biphasic is TENS. One that is not listed on here, which we are going to use in the clinic, is Russian current, and it is a type of biphasic current. So if you want to add that into your notes over here by NMES, Russian would be right next to that. Russian current is often used for the same things that we would use neuromuscular E-stim for. We often use Russian current in order to elicit muscle contractions and retrain muscles. All right, so measures of current flow. This is getting really into electricity and physics and that kind of thing. So I will try to sort of point out and highlight what the important things are I want you to take away from these slides. So electrical charge is measured in coulombs. Voltage, we can use either the volt or the joule. Currents are going to be measured in amps or amperes. Resistance is measured in ohms. And then impedance, I'm not going to talk a whole lot about, but we can talk about inductance, which is measured by the Henry, and capacitance, which is measured by the farad. So Ohm's law. This is the fundamental principle governing electric current. And basically all it states is that current is going to equal your voltage divided by your resistance. Again, you don't have to memorize formulas. We're not even, I don't think, going to do any math that requires the use of this formula. But what I want you to kind of just take away is the current that's being delivered is whatever power is being produced by the machine divided by whatever resistance it encounters. So again, the more resistance it encounters, the less electricity your patient's going to receive. Electrical charge, again, current is going to result from the flow of electrons. And I said that it's measured in coulombs. That is the charge that's produced by 6.25 times 10 to the negative 18 electrons or protons. Again, not something you need to measure or remember, or even we're not going to do any math with that. I do want you to know Coulomb's law. You've heard it, I'm sure. You just probably didn't know that it was Coulomb's law. But Coulomb's law states that opposite charges attract and like charges repel. And this is going to come into play, especially when we get to iontophoresis in that next unit. And talk about how it works. This is the fundamental principle of how ionto is going to work. Voltage is the tendency for current to flow. Electrons that are placed in a field are going to strain to move to the opposite pole, which creates a potential for work. A volt is the work required to move 1 coulomb of charge, and a joule is the energy required to move 1 coulomb or charge. So these are really just sort of dependent on what type of machine and what type of settings you're using. We're not going to get into the difference really between volts and joules. There's not much that we need to document regarding these or anything like that. I will say most of our machines are probably in volts, the units. All right, current. Current's measured in amperage, and that's the rate at which electrical current flows. So an amp or ampere is the current when 1 coulomb passes a single point in 1 second. The modalities that we're going to be using have a current flow that's going to be measured in milliamps or milliamperes. So you're going to see the abbreviation MA. Again, this is probably going to come more into play with iontophoresis than the types that we're talking about right now, but just kind of tuck this away. So again, current measured in amps. Most of the machines that we will use will be using milliamps. Resistance. Again, all materials are going to oppose current flow to some degree. Conductors are going to allow electricity to flow with ease. Resistors are not, right? Resistors are going to oppose current flow to some degree. Resistance, again, is measured in ohms, so do remember that. And you don't need to remember the specifics, but 1 ohm is the amount of resistance needed to develop 0.24 calories of heat with a 1 amp current applied for 1 second. Again, that's a lot. Don't worry about that. So again, remember, we have conductors, we have resistors. Resistance is going to be measured in ohms. And big thing here, again, skin is going to be the primary resistor to E-stim. So then once we get electricity through the skin, it's It's going to find that path of least resistance and flow, typically muscles, nerves, things with higher water content, which is where we want it to be anyway. That's typically our target tissue. So impedance, like I said, we're not going to worry too much about this, but this is an additional factor that might resist current flow. Inductance is the ability of a material to store electrical energy by an electromagnetic field. That's measured by the Henry. And capacitance is the ability of a material to store electrical energy by an electrostatic field, and this is measured by the farad. Again, there's not much that clinically we do that really relies too much on these two, so don't worry too much about inductance or capacitance. Wattage is the power of the current, and it's a relationship between the voltage and the amperage that's expressed in wattage. So just voltage times your amperage. Okay, that was a lot. I get it. Here's a really good place to pause, go take a little break, let your brain rest for a second. Like I said, we are going to go over a chunk of that material in lab so that, again, it hopefully makes a bit more sense for you. All right, so now we're going to talk about some circuit types. Circuits can come in either series circuits or parallel circuits. In a series circuit, think about old Christmas tree lights. At some point, I'm going to have to come up with a better example for this one, but this one works. So remember in the old school Christmas tree lights, if one light went out, all the rest of the strand went out from that point down, and then you could replace that, and then everything would work again. That is a series circuit. The electricity only had one path to follow, and that path was interrupted. And so from that point on, none of the other lights worked. A parallel circuit, there are many different pathways for electricity to follow, and it will find the path of least resistance, and if one path gets blocked, it'll just find another one. So this means that even if one light went out, all of the others could still continue to work. So that's your big difference between a series and a parallel circuit. So again, this is often how we draw circuits. Series circuit, again, just one set path for electricity to flow. The current is going to remain the same throughout the entire circuit. As compared to a parallel circuit, and I'm sorry these pictures are so tiny, but with the parallel circuit, there's at least 1, 2, 3 paths for the electricity to follow. And so again, it will find the path of least resistance, and it will continue to flow. And if one path would get interrupted, it'll just continue to flow through the other two. Each path is going to have its own amperage, but the voltage is going to remain constant because we still have the same amount of electricity flowing through the entire circuit. All right, so some characteristics of electrical generators. The modalities that we use in the clinic are typically running off standard household electricity. We plug them into the wall, or they might run off batteries. And so in which case, we just need to make sure that we have enough batteries in reserve in case they would run out. Before it can be delivered to the body, it has to be modified, right? So we plug the generator into the wall, and then that machine modifies the electricity, right? Because we don't want to just basically zap our patient with electricity. If you've ever touched an electrical outlet, it doesn't always feel the greatest. So we have to modify that electricity, and that's what the machines do. So they shape the current. They turn it into a certain waveform that can then be used by the body. Some of the different elements of waveforms are going to have different effects on how the tissue reacts, and that's why we choose different types of E-stim for different goals of treatment. So the last things we're going to talk about are how current is applied to the body. We're going to talk about average current, current density, and duty cycle. So average current is the absolute value of current per unit of time. This is what can cause some chemical and thermal changes in the tissue. This is meaningful for monophasic and unbalanced biphasic current. So this is only a property of our pulsed currents. It's measured in milliamps, and as the average current is increased, so is the perception of the stimulus. So again, average current, this is current that's averaged over time. This should sound a little bit familiar. We talked about this with ultrasound. The intensity that we use for ultrasound is averaged over time. Same thing goes for monophasic and unbalanced biphasic currents. The intensity that we set on the machine is going to be an average over time, and the higher we turn up that intensity, the more E-stim the person is going to feel. Current density can cause some physiologic effects underneath the skin. Current density is inversely proportional to the size of the electrode. So what that means is that the bigger the electrode, the more the electricity, or the more the current is going to be spread out. And so the person is going to perceive the stimulus less under a larger electrode. If you're using a smaller electrode, we're increasing the current density. We're concentrating all that electricity into a small electrode. And so the person's going to feel it more under that electrode. So again, pass a current through a large electrode and then a small electrode. The person will feel more stimulus under the small electrode because the electricity is more concentrated there. Duty cycle is the amount of time the current is on versus off. Again, this should sound familiar. This is very similar to ultrasound. We express it in a percentage, just like we did with ultrasound. So with ultrasound, we talked about a 100% duty cycle being continuous, ultrasound being emitted 100% of the time, pulsed, ultrasound's only being emitted 10% of the time. E-stim can work the same way. It can also be expressed as a ratio, and typically if we're trying to get a muscle to contract, we'll start at about a 25% duty cycle, and then we can increase it from there. So we generally start on the lower end, and then we can work our way up. The beautiful part about a lot of this stuff with E-stim is that as long as you choose the right waveform, the machine is going to take care of a lot of this for you. And you'll see that as we start to practice. All right, so I know that was kind of a lot, jam-packed into one lecture there. So write down any questions that you might have. Email me. Like I said, we're going to talk about some of this in lab again, which should hopefully make it make a lot more sense. There's also a decent amount of this that's covered in your lab where you're going to be labeling some diagrams. And again, I think a lot of this is going to make more sense after that. So we will spend a little bit more time on this stuff together. All right. Thanks, guys.